The OCTA Research Group has noted a spike in the COVID-19 reproduction rates of Cebu City and Lapu-Lapu City. Let's talk about this and more with DOH Central Visayas Regional Director Dr. Jaime Bernadas via phone. Good afternoon, Doc. Doc, first off, can you confirm that the COVID-19 infection rates in the cities of Cebu and Lapu-Lapu indeed went up in the last week?
Correct, John. Today we have an increasing number of cases of COVID-19 since almost a month already. Because if you know, we had our second wave in January February, March, April. Then in May, we have noted that this number of cases went down to single digits. Now, at the end of May, June, and July, up to now, we really had noted the increasing number of cases that almost reached 100 now for Cebu City, and now Lapu-Lapu between 40 and 60 cases per.
All right, Doc. Do you know which factors attributed to the spike, or do you know which factors we can attribute the spike to, or can you say that this is due to the spread of new variants, or is it just people getting lax and getting pandemic fatigue?
John, let me just correct. This is not a spike. This is a continuous increasing number. Meaning, if you look at this in an epidemiological curve, it looks like a wave. But let us clarify this. The wave should be dissociated with the hospital response and on the usual association NATO with the overwhelmed hospital system.
All right. Now, and how are the state of hospitals there in Cebu and Lapu-Lapu, Doc?
Yeah, that's what I'm pointing. Because during the first wave last year, we did experience an overwhelmed health system. But fortunately, in the second wave in January to May this year, we never really had, and we really never experienced difficulties in our hospitals, precisely because of our response. Meaning the hospital response has accorded spaces for our patients, has accorded the necessary hierarchy of care from mild to moderate and severe cases appropriately in the different levels of our hospitals, of our hospital system. So accordingly, the funds for COVID for One Cebu and for Region 7 has focused on the community. Meaning on the community response, we relied more on surveillance, identification of cases, testing, isolation, and then containment, then referral of symptomatic cases to the different levels in our hospital system.
Right,
now,
Doc.
our hospital
Go ahead, Doc. Finish.
also is connected all together with a 711. That's what we call our One Hospital Command, so that our patients are being navigated from the barangay to the health center, to the level 1 hospitals or infirmaries, to the level 2 and the level 3 hospitals, as the case may be. So if you look at now the situation in the hospital system in One Cebu, we have controlled at least the number of beds occupied in our hospitals. When we see controlled, it's within safe levels, below the ceiling of 60%. In fact, our hospital beds for COVID stayed within the 40 and 45% occupancy, and our ICU beds stayed within below 30,
Right,
between 25 and 30. So,
right.
If you look at the wave that it is really the number of cases that we see a period of time and that as we are referring to June and July of this year, which is still continuously increasing until now. The factors that we see actually is the economic activity and the attitude and behavior of our people. You know, we emphasizing adherence to minimum health standards. Of course, using our face mask, using our face shields in closed situations, and then strictly observing also in the in the transportation the distancing of passengers, and most especially social gatherings, parties, and all these sorts, which congregation of people go all together, which we see as the spreaders of COVID in our communities. So this and all have been somehow being problematic in an open economy, but we are trying to cope this up, meaning gathering around our leaders to really enforce the minimum health standards and the social gatherings and minimize this congregation of people altogether in our community.
All right. Dr. Bernadas, I just want to ask you if there was anything specific you did to improve your hospitalization or your hospital's efficiencies. Did you increase capacity, increase bed capacity, acquire any new apparatus or machines?
Yes. Look at it this way. Before COVID, you know, our private hospitals has a lot of number of rooms that has been deactivated. With COVID, the hospitals, especially the private hospitals, used them, but we deployed personnel to help them operate these spaces. So this happened in the first surge in last year and in January of this year, but tapered down in May when the number of cases went down. The hospitals also started to close down those extra beds. But now, in July, June and July, we also notified them to reopen them. We are deploying again personnel to them. So this is now the manner that we expand our capacity in the private sector and in the public hospital as well. We do not turn away patients in our public hospitals. We just expand to accommodate our patients. So in as much as our hospital system is concerned, we are coping with the problem. We are responding adequately. Our necessary equipment are still responsive. Logistics, medicine, and all together have been sufficient, including protective equipment. Now we are monitoring this very closely, and we are meeting as frequently as possible with our governors and our so that individual community responses in the barangay shall be fully and vigilant of all these activities, all the violations in the minimum health standards, and enforcement of protocols in the different communities.
All right, thank you so much for sharing your time and your insights with us. That was DOH Central Visayas Regional Director, Dr. Jaime Bernadas, over the line. Thanks, Doc.